Good morning, everyone. Today, our presentation topic is health, development, and sustainability in China. We will analyze China by using HALE, HDI, and PHDI indicators. Our course is Economics of Social Policy, and our selected country is China. In this presentation, we will discuss China's health, development, human development, and sustainability challenges. And our group member is Guo Xinzhen and Chen Xiao. First, why do we choose China? China is a very suitable country for this topic because it has achieved rapid economic growth and strong improvement in public health. Over the past decades, China's living conditions, healthcare access, and expectancy have improved significantly. China is also a strong example for HDI analysis. Its HDI shows a relatively high level of human development, including improvement in income, education, and health. However, China still faces many health challenges. For example, China has an aging population, more chronic diseases, air pollution problems, and unequal healthcare access between urban and rural areas. At the same time, China also faces sustainability pressure. Although China has a strong development, high uh, energy use, carbon emissions, and resource consumption create pressures on environmental sustainability. Therefore, China is a good case to show that higher development does not always mean better sustainability. This slide shows China's expectancy and HALE. Life expectancy means the total number of years people are expected to live. HALE means healthy life expectancy. It shows how many years people are expected to live in good health. In China, life expectancy has increased over time. This shows that people's living conditions, healthcare services, and public health have improved. HALE has also increased. This means Chinese people are expected to live more years in good health than before. However, there's still a gap between life expectancy and HALE. Life expectancy is higher than HALE. This means that some people may live longer, but they may spend more later years with illness or disabilities. This is important because China has a large aging population, and so China could not only focus on helping people live longer, it should also help people live healthier. In other words, improving HALE is very important for for China's future health policy. In these slides, it shows the leading causes of death in China. Today, China's main health burden comes from non-communicable diseases, also called NCDs. These are long-term diseases that are usually not spread from human to human. The first major cause is cardiovascular disease. This includes heart disease and stroke. These diseases are strongly related to aging, high blood pressure, smoking, and unhealthy lifestyles. The second major cause is cancer. Cancer is also an important health burden in China. Early screening and better treatment are important to reduce cancer death. The third one is chronic respiratory disease. This is related to smoking, air pollution, and long term exposure to environmental risks. The fourth is the diabetes and other NCDs. These diseases are increasing because of aging, diet changes, obesity, and physical inactivity. Overall, China's health problem has changed. In the past, infectious diseases were the major issue, but now chronic diseases are the main challenges. Therefore, China needs stronger prevention policies, early screening, and long-term disease management. This slide explains the main health risk factors in China. The first risk factor is smoking and tobacco use. Smoking is one of the major health risks in China. It can increase the risk of lung cancer, heart disease, and chronic respiratory diseases. The second risk factor is air pollution. Air pollution can affect respiratory health and increase the risk of chronic diseases. It also connected to China's sustainability challenge because pollution is related to industrial development and energy use. The third one is the aging population. China has a large aging population. Older people are more likely to suffer from chronic diseases and need long term healthcare services. The fourth risk factor is unhealthy lifestyle. Unhealthy diet, physical inactivity, and obesity can increase the risk of diabetes, high blood pressure, and cardiovascular diseases. This risk factor can show that China should focus more on prevention, not only treatment. If China can reduce these risk factors, it can improve healthy lives expectancy and reduce pressure on the healthcare system. And in this slide, it gives an overview of China's health system. China has made strong progress in healthcare coverage. Basic health insurance has expanded, so more people can access healthcare services than before. China has also improved its medical facilities. Hospitals, clinics, and medical technologies have developed, especially in urban area and major cities. In public health, China has made progress in maternal health, child health, uh, vaccination, and disease prevention. However, China's health system still faces some challenges. First, there is an urban-rural gap. Healthcare access is still unequal between urban and rural areas. Rural areas may have fewer doctors and fewer medical resources. Second, China faces aging pressure. The aging population increases demand for long term care, chronic disease treatment, and elderly healthcare services. Third, China needs stronger in prevention. Primary healthcare and prevention policies are important to reduce chronic diseases and improve HALE. To conclude my part, China has made clear progress in health and development, but it still faces challenges such as chronic diseases, aging, and air pollution and healthcare inequality. Next, my partner will continue by explaining China's HDI, PHDI, and sustainability issues.
Thank you, my partner, for explaining China's health indicators and development performance. Next, I will evaluate China's development from the perspective of HDI and PHDI. China's HDI is 0.797, whereas PHDI falls to 0.713. This represents a reduction of approximately 10.5%. The gap shows that environmental pressures significantly affect China's sustainability performance. Although China has achieved strong development outcomes in health, education, and income, those achievements have been accompanied by environmental causes. Therefore, sustainability remains an important challenge for China. After comparing HDI and PHDI, an important question arises: why does a higher HDI not always mean a better sustainability? HDI mainly measures health, education, and income. However, it does not consider environmental impacts. Sustainability also depends on factors such as carbon emissions, pollution, and resources consumption. In China's case, rapid industrialization and economic growth has improved living standards, but they have also increased environmental pressures. Therefore, a country can achieve a high HDI while still facing sustainability challenges. That explains why China's PHDI is lower than its HDI. Since sustainability remains a challenge, the next question is how can China improve both HALE and PHDI in the future? China can improve HALE by strengthening healthcare services, promoting healthy lifestyles, and improving healthcare across in rural areas. At the same time, China can improve PHDI by expanding renewable energy, reducing dependence on coal, and promoting electric vehicles. China is also pursuing its carbon neutrality goal by 2060, which can further improve environmental sustainability. Together, those policies can create healthier people and a greener environment. Although these policies offer many benefits, there is still an important issue that needs to be considered. This issue is the trade-off between economic growth and sustainability. Economic growth increases GDP, creates jobs, and improves living standards. However, industrial expansion may also increase emissions, pollution, and resource depletion. On the other hand, stricter environmental regulations can reduce environmental damage, but may increase production costs. Therefore, policymakers must find a balance between economic growth and environmental protection. China's green development strategy aims to achieve this balance. Finally, I would like to conclude our analysis of China. China has achieved a high level of human development, as reflected by its strong performance in health, education, and income. However, a lower PHDI shows that environmental pressures still affect sustainability. Therefore, China needs greener policies to balance economic growth and environmental protection. Overall, China has strong human development, but sustainability must continue to improve.
In these slides, we put some references that shows our data mainly comes from three resources: WHO data, Human Development Report in 2025, and UNDP planetary pressures and adjusted HDI. WHO data is used for health indicators, while the Human Development Report and PHDI data are used for development and sustainability analysis. Thank you for your watching.